So I've already done my irrigation and everything. I just want to make sure that I'm doing my sterile procedure. So I've obtained my wound care kit, my saline over here. So I'm going to go ahead and open away from me, away from the patient, toward me. Maybe if I can get it open. Then I'm going to grab over here, up underneath, or the small 1/4 inch around the edges is also contaminated as well, so you can use that. Then I'm gonna grab my sterile gloves. Oh. Okay, and then pinch, step away. Okay, that one's on. 2 fingers. Palms up, step away. Okay. And since I don't need that, I'm gonna plug it, get rid of it, and then I can move this from the inside wherever I need to. So I'm gonna take shiny side down. I'm gonna put my drape onto my patient, making sure I don't touch my patient and that the drape doesn't touch the wound. And then I can grab the middle here. I can move this around as needed. So I'm not gonna need that yet. Not gonna need these yet. Not gonna need that yet. I'm gonna turn it so that way I am not reaching over. Not gonna need that yet. And then I wanna make sure that I'm counting my gauze, and then I'm keeping one out to go over the wound when I go to dress it. So there's 1. So 2, 3, 4, 5, 6, 7, 8, and 9. So at this point, I can not turn my back on my sterile field. I can grab my saline. So now this hand is dirty. So I can unscrew and come out and around, pour some saline in there. And then I want to make sure that when I'm doing this that I am, before I place these in the wound, that I am, this is still my clean hand, so I am scrunching them out. So I can take my clean hand and I can put, let's say, my tweezers into my dirty hand, but I'm not touching the tip, so I can put them into my dirty hand. So I can squeeze this out, my tweezers, grab my Q-tip, and then I can place, making sure I'm not touching the wound with any of my supplies, and then I'm packing it. It's hard to do when they're dry, because it's sticking to my Q-tip. There we go. So pack, and I'll grab another one. I've already squeezed. If I want to, I can squeeze them out and place them into this one. So squeeze them out, grab them, place them, pack them down. You don't want this to be too tight. Pack it down. And I'm going to use as many as I need. Sometimes I won't need all of them. So after I've got all of the packing done, I can drop these, drop this, and then I can place one of my dry pads over the top. Again, making sure that I'm not touching it because I'm still sterile, so I haven't touched it. And then I can take my ABD and place it over the top. And once that's placed, it is now a clean procedure. It is no longer a sterile procedure. Just gonna move that a little bit, it was in my way. Okay, but you wanna leave it there, you don't want any drainage or anything to get on it. So my ABD's on, that means that I am now, in a, clean procedure and no longer a sterile procedure. I'm gonna grab my scissors. Put that on here. I'm gonna cut this, actually I'm gonna do my Montgomery straps first. So I'll take my tape. Oh, these stick horrible to this. Okay, and then I'm gonna fold about halfway down, fold down again, and cut a slit in there. And that's gonna be, and I'm gonna pull it back up, and that's gonna be my Montgomery strap. So I'm gonna be able to place this on this side of my dressing, and then I'm gonna be able to take, I'll make another one. Okay. 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 And then I can take this, cut myself a strip. And secure it through my Montgomery straps. When you tie this off, you want to make sure that it is not too tight, or that you don't tie a big knot in it, because you don't want your patient laying on that, depending upon where their wound is. So this makes for super easy removal of your dressing. To change it, so make sure it's secure, but you don't want a big knot. And again, this is going to make sure that you have your dressing secured, but also it's going to make for easy removal of like changing your dressing pad, things like that. And that is wound care. That is my sterile procedure for wound care. I forgot to say that I will be looking at the dressing when I take it off, noting any odors, color, consistency, anything like that. And also when I am all done with my sterile procedure, I will put it in a biohazard bag using the double bag method and dispose of it per my agency policies.